My name is Lucia Spencer, and I am with Immigrant Women's Services, Ottawa, where I serve as the Executive Director.
My name is Orlando Farrell. I'm the Executive Director for Quinte United Immigrant Services, a small organization located in Belleville, Ontario. I have worked for Quinte United Immigrant Services for the past 11 years.
At IWSO, we offer a number of services, and it is important for us to know what the community thinks about the services that we provide. And so at the board level, they established the Program and Policy Committee, and one of the functions of that particular committee is to look at the programs, evaluate them, and what they did at the time was to hire a consultant who in turn developed a questionnaire.
We don't have a larger budget. We cannot afford consultants to provide this type of research and feedback. So what we decided to do is put in place surveys that are confidentially given back to us through our clients. We have a system in place for that.
Program and Policy Committee of the board was commissioned to undertake this evaluation. And so the system they put in place was to have a small group of individuals from that committee whose responsibility it was to monitor everything that was going to be done, i.e. the hiring process of a consultant to do this evaluation, identifying the various service agencies that were going to be involved. The staff too had an opportunity to be involved in this particular process, and of course service providers and the service users. There were a number of tools that had to be developed in order to ensure all the key stakeholders, that is service providers, clients, staff, etc., can participate in the process. And so what was done is the consultant met with the program committee. She had a dialogue with them as to what were the goals and the objectives of the evaluation, what were they really looking for, what were the expected outcomes, and based on that she developed a questionnaire. And a questionnaire was delivered to board members, a questionnaire was delivered to staff, and a questionnaire was sent out to service providers. So people had an opportunity to contribute that way by filling out these questionnaires.
We also have another system that is a part of our requirement from our funders, that our frontline workers, they will have a follow-up with our clients, and this follow-up can take up to a few months even after the services have been completed, just to give us a position of what was the impact of our services. Are they satisfied? Have they improved their integration processes in our community?
We also thought it was important to hold focus groups, and so focus groups were held with some clients or service users, so they could have an input into the whole process. Focus groups were also held with select service providers, because the work that we do is we do jointly with a lot of service providers in the city, and we wanted to hear from those service providers who were basically our partners, and we also wanted to hear from service providers to whom we refer clients. So these are the processes that were used in helping us to roll out that particular evaluation. It's important for us to evaluate. You can do a formal evaluation maybe once a year or twice a year, but it's also good to do some informal evaluation, because many times we may have to tweak the service a bit. Many times we may have to make some changes along the way, so that the beneficiaries of the service are actually benefiting from it.
Biggest challenges we had was in terms of professional development. This is an item that is very, very onerous unless we would have a bigger budget, we would be able to overcome that challenge. Once again, we try to get stakeholders, and I will mention again OCASI, who has been very efficient in terms of providing professional development at low cost, and sometimes subsidizing those professional developments for our frontline workers. Professional development is very important on the quality of services we provide. With the dynamics of changing in services models and new approaches, it's important to keep staff informed and up to date with the service provision and the delivery of those services.
Whenever you're providing a service and you're providing the service to the best of your ability, and you assume that the service is meeting the needs of the service users. But sometimes it's always good to stand back, to reflect, and to take a moment to do an evaluation, because on occasion information is shared that can be surprising, and information is shared that is gratifying. And so what we have learned from this is that never assume that even though you're providing the service to these service users, that it is actually fulfilling the goals that you have set for yourself. So it's always good to hear from the recipients of the service how it's affecting them. And what we have learned is that it's important to connect with these individuals, because the outcome of the process also enhances the services that one is providing.
My advice for small budget organizations is try to use as much innovation as possible. The tools are out there, technology. You can effective communicate to your clients through new media. I would suggest Facebook is one of the examples. Anyway, internet media is out there, it's free, and it can be used very efficiently. Another suggestion I would provide for those organizations is to count on your resource of volunteers. They can be very, very useful when helping in some of the tasks that requires, quite a lot of work.
I think evaluation in the process, and it's an important process to go through, and I think it's even more important given the climate in which we are living today, where we are expected to do more with less. We are expected to serve our clientele or service users to the best of our abilities, and it's important for us to take that time to reflect on the service and to get to involve the service users in this particular process.